Dr. Boshart, in this latest episode, shines a light on a painful reality. The people who want to make a positive change exist, but they are being hindered by all sides. Genuine help not based on politics, not based on profiteering, and not based on the intent to do harm to an entire culture is being fenced in, even by the communities it serves, because the colonized mind remains a prisoner to the system. The injustices of human ignorance, apathy and greed raise their ugliness wherever human weakness invites them in. And unfortunately that same weakness is being mirrored all around the world. We need to join hands, embrace the courage of the few who lead for the benefit of others and not themselves, and follow their purpose. Thank you, Dr. Boshart, for being one of those generous souls whose leadership through action screams so loudly that your efforts have drawn attention. Let us hope that the support of your community will allow your path to be a long and happy one. This is TwoandaMic. Rise up and be curious.
Dung weche pek kod welo mabiro e TwoandaMic. Dung parodit kod jok mawuoye TwoandaMic. Seche tin sud buta wawinji e TwoandaMic. Wola wachokre, wabed piny, bi wawinje, ero chako, momit ndi, podcast makende.
I'm very happy to say once again by Dr. Samantha Boshart in Canada. Where exactly are you, Doctor?
I'm in the southwest of Ontario.
Super. Sounds so exotic. So for people who perhaps haven't had the opportunity of listening to our previous conversations, and I would strongly advise that they do so because they definitely number among the more emotional, meaningful and provocative, I guess, in many ways, because of the just the content that you informed us about. And your observation, unfortunately, continued from the first episode into the second episode, where you were quite clear on the fact that there is a genocide continuing in Canada with regards to their treatment of indigenous people, despite their promises. And you mentioned some of the extremely difficult situations which you had been forced to involve yourself in simply because there were no other solutions that had been provided for some of these poor patients. This was about a year ago, and your project funding had been cut. The decision had been made by a council in some other area where they had said that they had set themselves up to actually provide assistance for indigenous peoples, indigenous communities. But then when they actually found out how effective some of your work had been, they decided to pull the funding. And then you had to pack up all of the facilities that you had built up. And that's where, unfortunately, we were, because the very next day you had to close your practice. So that the timing was tragic, of course. What happened then the next day?
Well, that feels like forever ago. And, to speak on that, the organization that hired and then fired me, I never did get very specific reasons as to why, although recently I ran into an employee of that organization at a different workplace. And I don't know if this is just hearsay or gossip, but, she told me what she had heard about why they had, let me go. And it was very, I believe it. It was, I had one of the people I was caring for at the time had been admitted to the psych inpatient unit at the hospital. And him and I had a really strong relationship. He was very challenging for most people to be in a space with because he was, had an addiction to crystal methamphetamine. and he was a big personality, and he had psychosis, and we learned a lot from each other. But I found out they had admitted him like on a form, which is against his will, right, for treatment. And I went to see him at that unit. And that experience was challenging because the psychiatric ward is like a lockdown, right? So like you come in and there's security, and you have to leave all your things in a locker, and then you go in this hallway that's just bleak, and I remember like they let me into his room, and it was just an empty room with a bed and nothing, and I was just appalled at like, how does this space create healing for this person? If anything, it's going to make him more anxious and more. Anyway, so I went to see him and support him, just see how he was doing. And while I was there, the doctor who was overseeing his care came into the room, and I introduced myself and who I was, and we had a little discussion, but nothing overly, dramatic. And during that, like, the doctor left and then came back and said, "Oh, we've decided to discharge him." Like, they just decided in that moment they were going to discharge him. And so, I thought, okay. And since I was there, I could give him a ride, but he lived at the shelter where I was working, and so I gave him a ride back to the shelter. And what the organization took from that is that I actually went there and like took him out of care. And they were angry that I discharged him from the hospital. Like, basically, they think I interfered with his care and like broke him out of the psych ward. And I'm like, they just don't understand the system. Like, I had no power to do that. It wasn't even my decision. I just offered him transportation home, which I think is, I know a lot of physicians wouldn't do that, but I build my relationships with my patients. I assess my own safety. I assert my right as an Indigenous person to operate in these ways. But I don't know if it's true or not. But the fact that they saw that as like I did that, I chose to take him out, and I don't have that power. That doctor made that decision. I just happened to be in the room. And so if it was really based on that, and they made that assumption and didn't even speak to me, like, it just goes to show the fear, right? And they did give me some information, like it was about liability, right? They were worried about liability, and, and I understand all the fear and all of that, but I feel like really they should have spoken to me, because there are very clear, simple answers to these questions. And rather than speaking to me about it, they just decided to, and so that's what I'll say about that. And I have compassion for that system and those individuals, and I'm grateful for the experience. And I'm actually grateful I'm not in that space anymore, because, I wouldn't have been able to. It was a very difficult environment to work in. So since then, I got involved in the lower limb preservation, and I don't know if we talked about that.
A little bit, yeah.
I was involved in that as well during that time. The province of Ontario had recognized there was a lot of amputations of lower limbs happening in the province, and they wanted to get on top of that and find strategies to reduce it. And then of particular concern was Indigenous communities, Indigenous-specific lower limb amputations. So one of the local First Nations, the neighboring community to Chippewa of the Thames, where it's my mother's community, Oneida Nation is across the river. Anyway, that community asked me to lead that work for them. So I've been doing that now for a couple of years, and I guess on the positive note, the first year of that work was just, nose to the grindstone, right? And just do the work, right? Meet the community people, people with high risk wounds, diabetics, that are facing amputations if they don't heal these wounds, working with them very tightly and learning the system, like what actually happens in the system, and following them through systems, from home care nursing to surgical teams to hospital care to supply issues and all these things, learning all the layers of why these amputations are happening, and then finding a lot of answers. And then another funding opportunity came through from Ontario Health West, the indigenous portfolio, for indigenous specific led funding for this. And Oneida Nation agreed to be like the lead applicant, because of course as an individual I cannot apply for provincial health funds, right? Because you have to be a corporation basically, to have all those legal structures to accept a transfer of funds. So luckily all of that work I had been doing with Oneida had been enough to build relationships for them to trust me to write this proposal and apply for these funds. And we were successful, and we didn't get as much as we asked for funds, but we got 40% of what we asked for. So for the next 3 years or 2 years now, we have financial support to continue the work. And although it's on paper, it's 15 hours a week that I am funded for, it's probably more like 60, of my time. And there's lots of reasons why a lot of systemic reasons why I can't be supported financially for the work that I'm doing. One is that these project funds, one of the exclusions is you can't pay a physician for clinical care, under the funding model. And that's because Ontario has a health insurance plan. So as a physician, I have to bill the insurance plan to make my income for any clinical work. So I can't pay myself with the project funds for clinical work. But the issue that I'm facing is when I do try to bill that system, because a lot of the patients I'm seeing in the Indigenous community, they already have family doctors, but the care they have is not adequate. So if I bill the system, their family doctor gets basically dinged money. So if I bill for services for that patient, their own doctor gets taken money away, right? So it creates problems with relationships with other physicians. That's one problem. And then the other problem is, the billing structure doesn't support the work I do. So because I don't have an office, because I can't afford an office, and there's many reasons for that. I'm an Indigenous person. I don't have intergenerational wealth, and I'm unwilling to join the established structures because I feel like they're very colonized and they don't support our community. So I just do home visits, which works very well, but the system won't let you bill a home visit unless, the person is dying and can't leave their house, or they're frail and elderly, or you have to be able to prove that that person could not get to your office, right? So it becomes this very strange gray zone where I'm worried to bill, because I'm worried about being accused of fraud or some other. It's just been very difficult to be an Indigenous physician, working in a way that supports my community, but not be able to have the structures pay me because it doesn't fit in their box, right? So anyway.
I mean,
So that's where I'm at now, is I'm
okay.
doing my best.
I seem to recall when we last spoke that there were circumstances under which some people were being referred to surgery for amputations that you were suspicious of, in the sense that they didn't necessarily have to have their limbs amputated, that there were other stages that they could have tried before reaching that stage, but you had a kind of a feeling that people just chop it off and so on.
Yes, that is still an issue. I have a patient who was offered an amputation, and we had to fight and fight and fight, and he has his leg, he fully healed, but the orthopedic surgeons in the hospital, that was the only option they gave him. And had I not been there to question that, or to even let the patient know that, wait a minute, why? Let's ask why, and let's there's multiple patients. I have multiple individuals who have their leg today because our team exists. And they all healed, and they all are still healed. And and so I'm always questioning these specialists, right? And we've only lost, I've had one amputation, but it was, unfortunately, the referral came in like much too late. So there are some situations we can't, if they come in too late and the foot is black, I can't save it, right?
Sure.
But I think anything that still has blood flow and is viable can be saved, as long as they're not allergic to antibiotics or aren't resistant to the antibiotics, and we can give them really good care. So that still it still happens. It's still happening. I think one of the saddest realizations in my work is, the amount of malpractice that I'm witnessing. And I don't know if it can't just be indigenous people that are experiencing this. And because I don't take care of other people who are not indigenous, I don't have that insight. But I see a lot of people facing a lot of harm who have their family doctor, they have specialists, but those people are not like practicing to standard of care, or in fact are harming them. And so it's very confusing to me as a person who took this oath to be a physician and, not to do harm, to like watch this happen. And everyone says, well, it's our system's failing and it's overwhelmed and there's not enough doctors and there's too many patients, and so that's what's happening, right? And I don't know what it's like over there in Berlin, but
yeah, I mean, okay, obviously that's perhaps a conversation for another day, because we want to focus obviously on what's happening where you are. But I mean, it's not a fantastic situation either, and there's a lack of funds here too, and I mean, I would hesitate to guess that they're spending far too much money on bullshit wars rather than taking care of the people who actually pay their bills.
Yes.
But again, that's something we can perhaps talk about either later or on another occasion. The first time we spoke, and I have to say, and I still am, every time that you communicate that you are free to have a chat with me, I always get so excited. And I remember the first time because we met on Twitter, later it became X, and since I've left that community because of a certain, I don't know, tendency towards racism and sexism and so on.
Yes.
But before we had our first chat, you sent me a link to an article which was written about you, and in such glowing terms, and this article had also been released in more than one website. In a number of different papers had referred to it as the indigenous doctor. You were the interface between two worlds of medicine. You were this, I suppose, star, as it were, emboldening indigenous communities, and there was a certain element of representation that you were able to bring about. And so therefore there was a lot of attention there on the work that you were doing. And it seems as though that, I mean, please correct me, because obviously I'm far away. I don't have access. I don't know everything that's going on anywhere near the way that I would like to know. But it seems as though all of that attention has kind of been muddied in some way. Not that your reputation has been muddied, but the work that you were doing in such a way that it's like, okay, let's not talk about her anymore, because we don't want to give her any cash. We don't want to support her.
There is, I think, from the mainstream structures, even the indigenous, like, mainstream health structure that exists, like, does at this point, I feel, reject me. And it's not the community people. Actually, the community people are like, why is this happening? Like, the people that get care from me and know me are like, we really need you in this community, right? But the people, the structures that exist just seem very comfortable in, like, what is, right? And I think that structure is failing, right? And I challenge it, and so why would they want me in there? I don't know. And maybe it's my fault. I was a little vocal and okay, maybe unkind about that structure, but to me it was, when I see my community people being harmed, like, I'm going to speak up about it, and I'm going to continue to do that. I think now I'm just a little bit more mindful of how, rather than, like, calling people out or throwing them under the bus on social media. I try not to do that because it didn't go well for me. So, like, the academic institution, like the medical school, that a lot of the indigenous people that are pushed to the spotlight now are ones that are more palatable, more assimilated, more like, they wear their ribbon skirts and beat their drum, but they are not trying to change the system. They're just checking the box of representation for indigenous people in those spaces. Whereas I, like, refuse to do that, right? And that's just a learning and growing. Maybe, 15 years ago, I might have thought that was okay, but I don't anymore. I think we need to lead our own health solutions in our communities, and it needs to be led by people that have the education and the experience in both worlds, right? And that's what I represent. And some of our prophecies in the Anishinaabe history speak to this, that it is those ones that are from both nations, right? Those people that are both European, right? My dad's side, and Anishinaabe or Haudenosaunee or Lenape, or they have that both ways of being, right? And then they can, through that create something that works, and there, so we can be representing both, Western approaches and, technology and all that advanced medicine, but we still maintain that relationality, right? And that respect and that kindness and that humility and that connection to the land, and that, all of that is maintained, but we still use the best of what we have in Western or European medicine, right? And some people think, well, if you're an indigenous physician and you are blending Western and indigenous medicine, they assume that means I'm using plants, right? or I'm like spiritually doctoring people and I'm blending those things. But for me, that's not what it is. Um, for me, it's living the values of Anishinaabe values of like I'm not more valuable than anyone. My time is, we're all equally valuable in creation, and I'm here being of service. And so anyway, I wrestle with all these things because then I think, well, why should I be, physicians get put up on a pedestal and we do make a decent income, like more than most people. And I don't know how I feel about it. Yeah, that's a point of contention because for me, I don't need, riches, but I do need to like be able to support my family and myself and like feel valued, or at least that it's the value of my work is coming back to me. And right now I feel like the work that I'm doing is so valuable, but what's coming back to me from the system is not equal. And I'm watching all these other physicians and specialists cause harm and not take care of people, but get, bags and bags of money. And I'm like, it's hard for me to understand, that kind of, I guess, duality, right? Or what is that, right?
Hypocrisy. While you were speaking, you made me think about a number of things. Whenever scientists present a new kind of a theory, or I suppose doctors present a new kind of treatment within any kind of academic or scientific community, these new ideas have to be tested. The people have to be fully researched. The material that they present has to be proven in I don't know how many iterations of their experimentation on a number of occasions. And the people generally presenting them have to be so hard-skinned to face all the kinds of criticism that they should be able to responsibly and without undue emotional conveyance communicate their position. But it seems to me these kinds of structures, especially when they are so well established and supported by politics and politicians and businesses, they have to be resilient enough that they can face and expect and accept criticism where criticism is due, and be able to have a look, establish some kind of, if it's possible within that landscape, a sort of a neutral or objective committee to investigate what's going on and then come back and make recommendations.
Yeah.
If they cannot do that, then they are snowflakes. And if on the basis of their failure to look at themselves and reflect truly on what they should be doing, as opposed to what they are doing, and then they take you as an easy person to objectify and therefore mistreat and therefore cast aside, then that is an extreme failure in anything that they present themselves as being representatives of. Surely.
Yes. And I think the people, like the people on the community, people know see this. But there's, I always think like one day at a time, one step at a time, and, eventually it will change. I don't know. If I spend most of my days now dealing with, like the minutia of each patient I have and all their trying to sort of undo all of this harm and build relationships with all of their providers and try to get us all on the same page to, so that person can actually move forward, and I do this with multiple people day in, day out, and I don't have space right now to like focus my energy on that actual system, like to, get a meeting with the board of, the Aboriginal Health Access Centers that exist. Like, that space right now I don't have. I think it would be valuable, but for me, I'm like, I feel guilty taking my energy away from the people and giving it to back to the system again. And I know that there's a balance because it needs to be that way, but that right now, I know I need to do some of that. It's just, the patients always to me come first. So anyway, I don't know how to strike that balance. I'm only one person. And there are like-minded people. There are other Indigenous female physicians in this southwest of Ontario, one of whom is Dr. Karen Hill. She's Mohawk from Six Nations. And I look up to her. She's been like in this longer than me. And we don't get to connect often. I see her a few times a year, but there's only a few other women, right, or physicians who understand these things in our community, and they're the other voices, right? But they are in their own communities away from here. And one of the other, but both of them have had the same issues, right? Not being accepted, being kicked out of their communities, being ostracized. Dr. Amy Montour, she's Six Nations as well. She just has gone through being sort of dismissed and isn't even working as a physician right now when there's such a huge need. And so I realize, okay, I'm not the only one going through this. Like, the more you fight for a community, like the Indigenous community, and the more power you have in that, like, we're all very powerful women, but it's like the equal amount of stuff that comes against you, right? So looking forward, I'm hoping to meet actually with these women in the summer, and some other Indigenous women who work in leadership and healthcare. I just think we all need to come together and like support each other, but also like, collectively try to create some sort of solution. So that's on the table right now for August, to bring some of us together.
Would love to have a chat with you after that meeting.
Yeah.
As you can imagine. I mean, recently I had just a couple of weeks ago, I released a podcast where I'd met with not official representatives of these NGOs, but people who work for these NGOs, so Children in Need, Amnesty International, and we were speaking about some of the issues that they have to deal with, and obviously at the same time providing some kind of solution or ideas as to how they can improve the situation for the work that they do, but more importantly for the communities that their project work should actually seek to provide services to. And some of the ideas were about sort of crossing the divide in some ways and developing relations with companies, businesses which share similar space and could perhaps develop partnerships with, either on the basis of funding or advertising or awareness and whatever it may be. Obviously, every industry is a bit different. I mean, obviously you have contacts with other female physicians who are also of indigenous origin. Are there also companies or organizations and other structures with whom you could also team up and just to get more representation, just to get more financial support, something more along the lines of structure, infrastructure? There must be so much support for what you do, because from what I've heard and read, the work that you do, it's priceless.
I think it does exist. I think the biggest barrier for me, and this is like a very personal barrier, is that whole, like, in order to access funds, you must become like a corporate structure. And so that part of, like, I just have this very strong internal, like resistance to like, having a nonprofit and registering this and having a board of directors and following all these things that aren't our way. To me, like, as soon as that is brought up and I try to, like, okay, think about it, because, like, the steps are easy enough, right? You register, you pay your fee, you appoint your board members, but I lose, like, it's like my I don't know what it is. I just can't. It doesn't make sense to me,
Mm.
and it doesn't feel right to me. But it seems like that's the only way in this current society that you can access support funding, other than like crowdsource funding, I guess.
But I mean, you are in many ways the connection between the Western or the European world and the indigenous world. And the structure that you present there, in many ways, can also be translated into the indigenous structure in the sense, okay, you don't have a board, but you have tribal elders. You don't have a spokesperson. You have perhaps the person who is in charge of communicating whatever that role may be. I mean, there must be some kind of way, because indigenous peoples managed to do the kinds of things which modern technological companies simply cannot do. And I think we've spoken about it in the past. Tribal elders they always planned 7 generations in advance, or to something of akin to that kind of forward planning. And they existed for, I don't know how many centuries, 1,000 years or whatever, in very difficult climates, fighting against all of the things that society fights against today, whether that is poor weather, poor harvest, conflict and disease and so on. So all of those things that they fought against, and they managed to survive for century after century after century. So surely there must be.
So this is the thing that, yes, I understand our ancestors, they had amazing governance structures, and all of that has sort of been degraded, and I don't see any examples locally of this happening anywhere. And if I did, I would love to see, if it exists, I want to see it, right? Like a sovereign, governance structure that is operating as close to how it used to be as possible would be amazing to see. But I don't have examples of that. And it's just it's just an idea in my brain, but it has no structure, because I don't know what that looks like. I think the closest I've seen is when I traveled down to the pipeline protest in North Dakota, and we all sat, like, they had a governance structure established there, and we sat all together in like a sharing circle, and the way in which they operated that, I'll never forget that, because it made sense, and it was inclusive, and it operated in such a way that everyone was heard and all the issues were dealt with, no matter how long it took, right? And so that's the one example that I can think of that I've witnessed in my life, and I try to bring that to different meetings, but never sticks, because I don't know if people are just so. It's basically a sharing circle where you start with one person and you go around and it's turn by turn by turn by turn. You can pass or you can speak. And it just keeps going until everyone has said what they have to say and everyone's in agreement. And it's so simple, but it worked there. And it was done in a ceremonial fashion, right? Spiritually grounded, and there were support elders, so that kind of a structure I think would work, and it's just identifying, and then we have our own clan structures, right? And different clans have different responsibilities. And I'm Golden Eagle Clan, which is there's leadership and education responsibilities, but also spiritual sight. And so in all of this work, I'm always thinking about my responsibilities in that way, right? And I never considered myself a leader because I thought leadership was defined by the Western view of leadership. And so I didn't see myself that way. And it wasn't until I learned about what indigenous leadership was that I said, okay, maybe I am a leader. I just didn't think of it that way. So it's more quiet and humble, right? It's just leading by example, and being kind and inclusive and encouraging and building relationships that take a long time, and it's slow work. It's not, it's not big on top and loud, and I think whenever I try to do that, that's when I get in trouble. So yes, our ways of governance is what I would like to establish in the creation of what I want to do for healthcare. But it's been, one of the chief and council in my community, one of the counselors, in fact, the one who leads the health portfolio, directly said to me, "We're colonized. We don't want to operate like that. We don't want competition in this community for healthcare. And so they're not going to support me." And that's what she said. So this was just, within a year because I actually went to my own community, Chippewas of the Thames, to let them know about this funding opportunity that was coming. And I said, this would be a great opportunity so that we can continue the work in lower limb preservation and diabetes, and that's the response I got. And at least I was grateful they said it straight to my face. I didn't have to keep fighting about it. And so luckily Oneida across the river were happy to support. But my own people, my own nation, my own community. And that's another issue we face. I don't know why it is that way, but it seems like our own communities are the most violent against us, especially those who grew up off reserve, because my mother left due to her experiences there, right? She had a lot of internalized racism, and she did not want to she didn't want me to know who I was, really, right? It was safer. And so now that I grew up and I became a physician just to do this work, and I try to come back and help my community, and they reject me, right? And and I don't know. That's another layer of struggle for us as Indigenous people, is our own community relationships and the effects of all of the intergenerational trauma, right? It's ongoing, but I'm glad to have support from the people, not the politicians, I guess.
Yeah, I mean, there are so many parallels in some of the histories that are close to me, being of Armenian ethnic origin, and I remember reading about the sort of reawakening of Armenian identity during the times of the Ottoman Empire, and when the Armenians were fighting against the genocide that was being brought to their doors, and the kind of the fighters from within those communities who were trying to save the lives of the people. And sometimes the people would close their doors to these fighters who were there to help them, but they closed their doors because they were afraid to be seen to be supporting these sort of rebellious elements, and that's almost similar to what you're saying. Is in you're fighting for this community, but the community themselves are pushing you away, and maybe that is born of fear. But then I also think about some of the things that I've learned from the people who I've spoken about with regards to different African nations, either Nigeria or Kenya, and the topics that they bring up, and some of the most, I suppose, inspirational thoughts that they produce are, decolonize the mind. We have to decolonize our own thoughts to liberate ourselves. It's not just enough to have our own national anthem, our own land, our own flags. We ourselves are colonized. Our minds are colonized. We think in colonized patterns, and we need to liberate ourselves from our own colonization. And that is such a hard process.
It is, but it's possible. I remember thinking like I was 99% assimilated, right? I almost was lost, and I had to turn around and walk the other way. And I'm really grateful that I did that. And it's an ongoing process of self-reflection and growth, and I learn every day from my colleague or my nurse that I hired. She's a settler, and she is she has a very good heart, and that's why I hired her. And she's also very skilled at wound care, but it's interesting watching her. She had zero contact with the indigenous community before she met me. Really, other than some of the patients she saw like in shelter spaces, but she's out on the reserve, with me by herself, learning, going into homes, like it's just questions, like she's learning so much that she didn't know, and just speaks to the fact that like most people like have no idea, right? They have no idea about the lived realities of indigenous people, and the thing is we have to be more interacting with each other in real ways, right? There's a huge disconnect, and I always say like that all the people who are colonized or were colonized long before us. Right? They brought that sickness of colonization here. And it's not who they are either, but they forgot who they are, right? They're just farther away from it. So I'm grateful, although all the atrocities we went through, I'm grateful it's at least closer historically. So we haven't lost who we are. We still have it. It's in pieces, and it's all, we're trying to collect all the pieces and try to reestablish that, but I'm so grateful it's still there. But rebuilding governance, clan systems, taking power back to rebuild systems, I want it to go faster.
Yeah. I mean, I don't know how much room there is to talk about any kind of systemic changes that the government of Carney has produced, whether or not there has been any steps of a progressive nature with regards to the indigenous community. I mean, I don't know. Have you noticed any significant change in policy?
Right now, there is this big push from the government for First Nations to become municipalities, which is not great. So, and I don't understand 100%, but I think on the surface they present it as sovereignty, but what it is like giving up rights. So I don't think it's a good thing. There was a huge announcement recently that the federal government has cut almost, I think it was almost 80% of the funds to Indigenous Services Canada, which is very scary. So I don't know what that's going to look like, but we're already feeling it in terms of coverages for health requirements. Right now we have a treaties, we have the right to health care. So there is an indigenous specific health insurance. It's separate from OHIP. It's called the non-insured health benefits, and it's through Indigenous Services Canada. So there's drug coverage and dental coverage and medical equipment and supplies, medical transportation. So there are coverages, but with all these cuts, the access to them is just terrible, and so a lot of people are not going to be able to access what they need, and I feel like that's going to be getting worse because the funding purse was just slashed huge by this government, and so that's not great. A lot of communities are involved in this thing called health transformation. So the First Nations are attempting to do what British Columbia did many years ago, is to basically an agreement to move all the money from the government to the First Nations for healthcare, so that they will operate their own healthcare services. So that's called the First Nations Health Authority out in BC, British Columbia. So in this area, they're trying to start that process, but that actually worries me because the outcomes of the FNHA in BC have not been shown better. So the health of the Indigenous people in BC has not improved since they had control over their healthcare dollars at all. In fact, it's worse. So I know that's not the answer. And so now that our communities here are planning to do this, it worries me, because it's not necessarily about who gets the money and how the money flows. It's not about that. It's about the actual care that's provided, right?
And if it's real care, people who are more aware of, in general, some of the medical controversies over the last 100 years on your side of the Atlantic, but further south, as in the African American community, there is serious distrust towards medical practices and malpractice. Essentially, when women would go in for a normal operation of some sort, and then they'd have the uterus removed or some other kind of horrific surgery which they had not given permission for.
Yes.
And this was systemic. And so therefore, to have the fears that you have, I think people should realize that with the background that exists, it's not unrealistic.
Yeah, we have forced sterilization or coerced sterilization here as well. I think there was just a report released that it's still happening. And it's more visible now with social media, and there's been a lot more attention on these kinds of matters. But from my perspective, within the systems, we talk about murdered and missing Indigenous women and girls, which I think the National Day for remembering that was yesterday in this area. And I also consider that, I consider all of these people that are facing healthcare negligence and even direct harm part of that. Because if you are neglecting your patient, is that not murder?
Absolutely.
And so it exists in all the systems, and yeah. It's heavy thing. The heaviness I carry it's a big burden, and in this project work with lower limb, I have lost a lot of patients, and I recently lost a young man who, just an amazing young man who was so neglected by the health system and had the worst combination of medical issues that needed really good care. He had type 1 diabetes and celiac disease. So he had a severe allergy to gluten and also type 1 diabetes. And can you imagine having that combination and living in poverty and complete lack of healthcare knowledge and lack of support? And I spent a lot of my year trying to save this young man. And he was doing pretty good, but he passed away at the hands of a negligent, he was actually in a long-term care facility, which was the only place I thought he would be okay. He couldn't go home because he kept almost dying there, and he needed supervision medically. So the system agreed to put him into a long-term care, even though he was very young. He was only in his 20s. And he did fairly well there, but unfortunately, the long-term care facilities are underfunded. The staff are not astute with medical issues, and he was found, just passed away in his room. And I had seen him probably a few days before that, and he was perfectly fine, and then he wasn't, and nobody, I don't know what happened, but leading up to that, I had the thought, and I have a few patients in this facility, and I've had to get ambulances multiple times when I go visit, and I find them in this state, right? And I had a thought that they were gonna kill him. That's what I thought, and that's what happened, and that's my opinion. And I've witnessed it multiple times in these spaces, and that long-term care facility is in the First Nation, and anyway, that's a whole nother thing. But I would not want my family members living. Actually, my grandmother lives there. She's 96. She lives in this facility, and I didn't want her to go there, but I said, Grandma, just come live with me. I'll, but she didn't want to leave the reserve, and I don't live on the reserve, and she didn't want to be a burden, so she's there. Luckily, her health is pretty good, so she hasn't had any issues. But anyone who's in that facility who has any active health issues that need monitoring, aren't safe. So. And again, their system, right? There's a physician that oversees care, but he's pretty far removed from the care. He comes in for a half day a week, and there's about 90 people that live there. And so he relies on the assessments of, frontline nursing that might not know what they're doing, right? And, he won't come in and extra. So there's processes now questioning. I think they're under investigation, actually. I have a patient, again, one of my patients with lower limb recently had to be transferred out urgently and was very ill, and ended up getting very sick and almost dying. And luckily her family has the knowledge. I know her family really well, and so we were all communicating about this, and they were, have the finances and the know-how to take this forward. So I was super grateful for that. But this other young man, his family, didn't have that ability, so I don't think it went forward. Just, I hate to say it, just another dead Indian, but a lot of deaths that actually are suspicious or need to be investigated aren't, at all, because the families don't have the ability to take it forward, right? So I'm glad this one family is got a lawyer and reported to the ministry, and now the home is under investigation, and hopefully something comes of it. But these people are all my patients are like family, and I don't know if that's wrong or right, but, some physicians will say you're overly, overly involved. You're gonna burn out because you care too much. You have to keep this separation, but it's not my nature, and I'm here to do a job. I'm here to be a doctor. Doctors take care of people. They solve problems. They medicate. They assess. But not all doctors are doing that.
In a world so poorly lacking in empathy, to see people such as yourself who are flowing with it naturally, I think it's reassuring. But at the same time, it's difficult to listen to how much you have to deal with, unfortunately, as a result of that. Yeah, Doctor, thank you very much for your time. I've got 101 questions, but I know you've got so much to get on with as well. And to be honest, it's probably a good place to take a break, and then hopefully very soon we can have a chance to speak again. But thank you very much for coming to speak with me. And you know how much I respect the work that you do and the way in which you do it, and you are a treasure to your community. And I'm happy that there are some among them who can appreciate that. And
well, thank you for having me.
Two and a mic.